Welcome back. The World Health Organization has set a new target to eliminate viral hepatitis by the year 2030. It's estimated there are more than 40,000 people living with the condition in Scotland. Our reporter Marelle Wilson spoke to one man from Edinburgh who's living with hepatitis.
Bob Leary has lived with hepatitis C for 30 years. 3 years ago he underwent a liver transplant after his organ failed.
My body just virtually gave up. The organ went, and I ended up in quite a painful situation. Didn't know what to do, and then got taken in for assessment, and from there ended up with a transplant. I try not to dwell on the tough times, but it was quite severe. You just didn't know what was happening, and you were very tired, and sometimes I thought it was an ageing process, but now I realise it wasn't that.
Bob is just one of an estimated 40,000 people in Scotland who live with some form of hepatitis, with injecting drug use the most common method of transmission. And while research into the virus has come a long way since it was discovered 50 years ago, there are still misconceptions surrounding it.
A number of people who've been at risk of hepatitis have heard horror stories about the treatment. The good news is, in the last couple of years, treatments have greatly improved. The drugs that became available in the last couple of years are thanks to hospitals in Scotland participating in trials, patients willing to help progress developments in therapy.
Today, we have the opportunity to create our next greatest achievement.
On World Hepatitis Day, the World Health Organization is launching a campaign to eliminate viral hepatitis by the year 2030. Experts say this goal is more than achievable, but are calling on pharmaceutical companies to reduce drug prices and are encouraging more people to get tested.
We need to find people. We need to get the drugs available to the people who need them. So how that happens, once drugs become generic, it's a lot cheaper, obviously, but before then we still need to get the ones who are most at risk, who have the highest levels of liver damage, so that we can get them into treatment to stop that from progressing.
If elimination of hepatitis becomes a reality, it's estimated 7 million lives could be saved by 2030. Marelle Wilson, STV News.